The health of women, who form half the population in our country, has been a crucial factor for their emancipation. Advancement in medical care and reaching them to women have been critical factors. Rao Hospital and Care at Coimbatore is one such institution which has played a stellar role in promoting women's health. It all began over 50 years ago. Major Dr. R.S. Rao, after his service from the army, began his career in private practice in the then small town of Coimbatore. Armed with a plethora of medical degrees from UK, ranging from surgery, medicine, chest medicine and even dermatology, he started the Sri Ramakrishna Nursing Home in the compound of his house in R.S. Puram. The quality of medical attention resulted in more patients, necessitating shifting to a bigger premises at Periyasamy Road, R.S. Puram. It was soon renamed Rao Hospital. Major Dr. Rao was a bold and accomplished surgeon. His hospital soon became a formal reference centre of excellence for general surgeries. He dealt with deliveries and performed general, neuro and even cardiac surgeries, all with his limited infrastructure. As a founder trustee of the Shankara Eye Care movement, he championed the cause and spontaneously offered his hospital premises where several corneal transplants were done initially. He was also a great motivator for the professionals who worked with him. Dr. J.G. Shanmughanathan went on to start the Ganga Hospital. Dr. Shankara Narayanan set up the Rasi Hospital. The Rao family has been in medical service for the past 4 generations. The late Dr. D.R. Rao was trained in the UK and served as the Chief Medical Officer to the Cochin state in the 20s. He was the first physician to the royal family. His son, Major Dr. R.S. Rao, had established the Rao Hospital and served the people of Coimbatore from the 50s. All the 3 sons of Major Dr. Rao have also pursued medicine. The torch is now being carried by Dr. S.R. Rao, belonging to the 3rd generation from the late 70s. His wife, Dr. Asha Rao, a gold medalist in medicine from the Mysore University, did specialization in microsurgery and laparoscopic surgery at Belgium, Germany and UK, and soon joined the hospital. Together they greatly expanded the reach of the institution.
Bearing as I do the torch for the 3rd generation, it is my hope that the next bearer of the torch will further expand the services of this hospital to meet every singular need of every woman, regardless of clime or creed, rich or poor.
The 4th generation of doctors, Dr. Archana, a gold medalist from Coimbatore Medical College, who has completed her MRCOG from London, and Dr. Damodar R. Rao, who has completed his MD, will soon start their service. The Rao family is close-knit and committed to their chosen cause, where members support each other both in their personal and professional lives. The hospital has several firsts to its credit. Dr. S.R. Rao established a laparoscopy unit in the hospital in 1976, which was the first of its kind in Tamil Nadu. A self-trained surgeon, he fine-tuned the art with his training at Belgium and Germany. He has performed hysterectomies, removal of fibroids and tubal blocks laparoscopically, much before they became commonplace. The hospital soon became known for its focus on assisted reproduction. The microsurgery and fertility unit were established as early as 1985. Hysteroscopic surgeries are being performed since 1990. The first gift baby and the first IVF baby of Coimbatore were born in this hospital in 1997. The first ICSI baby of the city was born here in 1999. And the first vitrification baby was born in 2008. Today, the hospital is a FOGSI recognized training center for infertility and an advanced training center for gynec endoscopy.
Motherhood is the ultimate dream of most women, And we at Rao Hospital make these dreams come true. We have an excellent fertility unit with the Test Baby Center, which is a world-class center. And we have very high take-home baby rate, which is comparable to the centers in the West. Our strong support comes from Dr. Rao and his team, who have been doing excellent laparoscopy and hysteroscopic surgery over decades, removing tubal blocks, fibroids, ovarian cysts, etc. The babies that are born after these procedures are very precious and they are the priceless gifts of God.
Thousands of couples have benefited by the fertility treatment at our fertility clinic. IVF and ICSI are a boon to couples with tubular blocks and low sperm count. More than 650 test tube babies have been born in our hospital in the last 12 years. It has also been in the forefront of various scientific developments and has organized several conferences and seminars. Recently, as a part of the Golden Jubilee celebrations, an international conference, INSIGHT 2009, was organized in January 2009, which was well attended by a large number of delegates. What differentiates the hospital from several others is its excellent infrastructure and a well-knit, committed team of doctors, paramedics and staff. The IVF lab and the neonatal ICU are among the most advanced. While the lab in the hospital has the requisite facilities, the 4D ultrasound scan comes in handy for diagnosis. The labour suite, a new concept in India, has been introduced in the hospital where a woman delivers in the comfort of her room. The two major causes of cancer in women are cervical cancer and breast cancer, which together account for over 2/3 of cancers in women. The hospital has facilities for colposcopy and mammography. The excellent treatment and care offered here has created strong bonds with families spanning generations. As a part of the Golden Jubilee celebrations, the hospital is launching 2 new initiatives to cater to weaker sections. Project Sharada will offer free outpatient consultation and subsidized treatment on Friday afternoons. Project Meera is a cancer screening program for the breast at subsidized prices. 50 years after inception, the dedication and commitment of Rao Hospital to serve the people with the best in Medicare remains as strong as ever. Inspired by the trust reposed on it by generations of patients, the institution marches on in its chosen path of excellence.